Hi, everybody. So I am Jordana Moerbe. I am the lead for the Transforming Shelter Clinic to Foster Clinic HOS Working Group. And I'll be joined by, I'm not sure if she's on yet. Oh, there she is, Dr. Sarah Reardon from Greenville Animal County Shelter. And we have just kind of a short presentation for you on foster and clinic communications, because we feel like it's a really important topic. And it can really kind of, kind of make or break how big your foster program can get, and how to best serve the animals that are in that program. And it seems like it's a challenge, right? It's always a challenge. I feel like communication in general is a challenge. When you have two very busy programs, it can be a challenge to communicate effectively, efficiently. And then you have the third party, the fosters, to take into consideration also. And of course, we always need to make sure that we're serving them as best as possible, and everything else that's going on. So we have a quick presentation, and then we're going to leave some time for some questions, and just kind of like Q&A, open the conversation up. Dr. Reardon, do you want to introduce yourself real quick?
Hi, I am Dr. Sarah Reardon. I am the head shelter veterinarian at Greenville County Animal Care in Greenville County, South Carolina. I think Sue Caniff, our foster coordinator, is in this group. I think she's in another meeting today. So.
Awesome. Does anybody have any questions before we get started? All right, so I'm going to share my screen here. Okay, can everybody see my screen? Whoops, not that kind of share. What am I doing? Present. Okay, so we have been working in the Transforming Shelter Clinic to Foster Clinic, and this presentation is on foster coordinator medical communications. And so why are we talking about this, and why did we feel like it was something to just kind of open the conversation with you guys, and see what you guys are experiencing and what your thoughts are, because it's a cornerstone of any foster and medical program. If you have a foster program and a medical program, they're going to work hand in hand really closely together. And again, it can be really, it can be a difficult thing to maneuver. And then again, we add in fosters. And so it's, it's like a party line communication. I really feel like it can make or break the expansion of a foster program if your medical clinic can't keep up. That's going to be a huge issue. One, because the animals are not going to get the care that they deserve and that we need to provide them. And then it's going to result in communication breakdowns between medical and foster, medical and foster team, and then any volunteers, and then between foster caregiver and foster team. So there's lots of communication going back and forth. And then again, it's necessary to serving animals. We have to have good communication. And again, it can be difficult to maneuver this. So the goal of the communication, we want this communication to be efficient. So we really need to make sure that there's like minimal back and forth. If we're shooting an email to somebody, we want to make sure that we're getting all of our questions answered, and we're not resulting in like, 10 emails going back and forth trying to get a straight answer. We want to make sure it's standardized. Do we know how to communicate with the medical clinic, when to communicate with the medical clinic, and sort of what that looks like? It should be relatively the same every time you reach out to the clinic, and vice versa. So I'm not trying to worry about, do I need to be checking my phone? Do I need to be checking Facebook? Do I need to be checking email? It should kind of just be standardized. Maybe not all in one place, but you know what to expect and where to expect communications. And it should be appreciated by all three parties. So the foster team should be happy, the clinic should be happy, and the foster caregiver themselves should be happy with the communication that's happening. It should be serving everybody that's involved, not just one program or one person or one team or one foster home. It should be something that is, again, just appreciated by everybody that is communicating. A few things to consider. Using multiple platforms, it's really hard to find a one size fits all when you're looking at how, what technology are we going to utilize to communicate. In my experience and what I have found in talking with other shelters and other people is that it really does require multiple platforms. So that could look like email, it could be chat, it could be I'm not really familiar with like Acuity, but if Acuity has like a chat function or a message function, you likely need something on top of that if you're going to be sending videos back and forth, pictures, quick communication. So kind of just looking at what all is out there. There's a lot out there. There's a ton of options that we could be using, and just making sure that we're actually using the most efficient options. And if we need to grab something else and implement it, that we're doing that. Scheduling who is on each day, and what I mean on like who am I contacting today? Who's the point person? And this should be for each team too. So for the medical clinic, for the foster team, who should the fosters be contacting? What are the hours, normal business hours? And then it should ideally be, it shouldn't just be one person. And I know that's really hard because a lot of shelters don't have the ability to hire multiple foster coordinators, right? That's like pretty rare that can happen. But then at what point do we start reaching for volunteers to help with that? So one person isn't working 7 days a week and then being on call 24 hours a day, because that's not sustainable. And it just creates a lot of burnout. So making sure that we're pointing to people that, you should be reaching out to this person this day and this time. If it's after hours, maybe that's the same person, but maybe it switches to a different person. So we know exactly who we're supposed to be communicating with. Triage. What questions, and many of you guys may know this, many of you guys may have this in place already, but what questions can you ask fosters if you are that middle person communicating between the clinic and the foster caregiver? What can you make sure you're asking of the fosters or of the clinic to eliminate back and forth? Because the triage process, if you're the first point of contact for fosters with a medical question, you should have somewhat, maybe not solid documented kind of protocols or standardized SOPs, but something that you have been given from the clinic that says, if this, then this, at least for your top, maybe most 5 common issues, and maybe even beyond that. But definitely we want triage to start with that first point of contact, which is very often foster coordinators, because again, that will just eliminate all of the back and forth between the foster caregiver and the medical clinic. And of course, that foster coordinator in the middle of both of those. Any questions so far? I can't see the chat, so if you guys have any questions, please let me know. Just say something, or somebody can read the chat off to me. And so one thing, going back to the scheduling who is on each day and time, this is something that I really struggled with. I managed the medical clinic at Austin Pets Alive for the first about 9 years or so. And we grew a lot during that time period. And one thing that I had a problem with was people would come into the clinic and ask a question of the first person they saw. That could be the veterinarian, that could be a technician, it could be a volunteer. Everybody was so busy, they would just stop the first person that they saw and ask him a question. And the clinic staff, trying to be helpful, would respond, but not give a great response because they were doing a million other things and weren't the correct person to ask. And so really identifying who should be asked what and when really made our medical clinic much more efficient. And then some tips for communication. Dr. Reardon had recommended, and she can probably speak to this, regular communication, kind of like a weekly rounds check-in with between the 2 teams to identify problems, what's working, what's not working. I would recommend, I know with COVID it's kind of hard, but face-to-face would be possible if you can, social distance outside, because it's easy to, and we've all experienced this, to get caught up in email and you kind of forget that the other person is a human being that you probably actually like, because everything's just, going through email and electronic. It can be hard to, it helps to have that face-to-face. Dr. Reardon, do you want to add a little bit more to this, the regular communication, weekly rounds type of discussion?
So I guess.
Oh, you mean?
Yeah, there we go. We good? So our program with medical fosters has expanded quite a bit since COVID has started. And I was finding myself that, that I was sort of forgetting about some of the longer term medical cases, some of the ones that have a more chronic condition or something that's stable, but needing kind of ongoing care. So things like that were kind of, slipping out of my mind a little bit, out of the forefront with everything else going on. And so my thought was just to do a weekly rounds check in to see kind of, where we stand with cases, update everyone so everyone knows kind of what's going on with some of the longer term or more critical cases, so that people can at least have an idea of if this person calls, what might be going on with the case, what might be needed to address, and sort of who to speak with if they do check in. So that was my thought.
Yeah, that's great. Thank you. Another tip would be asking for a list of conditions that are emergencies, so that if you as foster coordinator are that first kind of point person, if a foster has a question, how can you quickly identify, is this an emergency? Is this something that needs to just come immediately into the clinic? Is this something we need to call the clinic about? Can this be an email? Because there's those different levels of how quickly do we need to get back to this person so we can best serve the animal. And I know in our clinic, it's, there's conditions that you just walk in for, just head to the clinic, come in. It's an emergency, something that we need to talk on the phone about. Give me a phone call because it's urgent. Maybe they need to come in, but the foster coordinator needs a little bit more information or more guidance from the clinic. Or is this an email? And it helps for the foster coordinator to know those things ahead of time. So that's something that you can ask your clinic for. What are questions that you can ask to identify emergencies? Clearly communicating the needs of the animal. So we do this in the form of discharge forms. So we started this with appointments. When a foster would come in for a scheduled appointment, the clinic spends time talking to them, but the foster is there in the moment with their foster pet, trying to absorb everything, but also paying some attention to what's going on with their foster pet. And so what we found was they were going home and they just wouldn't remember most of the information. This is true, I think, of human beings in general. You just don't remember. You think you're paying attention, but there's a lot going on, and so information just gets lost. And so we started writing down for fosters what the results of that appointment were and what next steps were, things to look out for, that sort of thing. So when they got home, they could always reference that piece of paper, and the foster coordinator wasn't called or emailed about it because they weren't sitting in the appointment. The medical clinic wasn't called or emailed about it, just taking up, time. And so sending them home with something was really helpful. We now use it for hospital patients. If an animal's been hospitalized, just like human hospitals, we give them a discharge piece of paper that has all of the information on it. And then another thing Dr. Reardon recommended, which I thought was pretty awesome, was like a liaison team member. Dr. R, do you want to talk a little bit about what you guys are looking at for that?
Sure. So we're kind of looking at reorganizing our foster organization so that we have kind of teams within the foster department. So medical team, behavior team, bottle babies, whatever. I forget how many groups that Sue wants to actually split it into, but the idea would be that they would have sort of a team leader with ideally several volunteers under them to kind of manage that department, so that when calls came in for behavior, they were transferred to the behavior team member, with the team leaders acting as kind of bridges between the two groups. So if we had our medical team leader in the foster department then would be kind of one foot in the medical department, one foot in the foster department, able to more streamline communication between the two groups, and kind of know what was going on in both departments so that we could all keep a pulse kind of on what was happening.
Yeah, and that's great because it's kind of taking like a case manager approach to it. That that liaison can kind of serve as like a case manager for the more complicated cases, or for the fosters maybe, you know, that are maybe new or need a little bit more hand holding, that there's that point person that can handle that, and it's not going between 8 different people or 5 different people or even 3 different people. It can be a lot. So it's great. And it can be a volunteer person too. So questions for the group. So these are a couple of questions that we had for you. And I put my email here so we can open this up for discussion, because I'm interested to hear what you guys are experiencing, but you can also just email me the responses to these questions. But what we're wondering is, what do foster coordinators need that they are not getting? And this can be specific to your shelter, because we're just kind of looking for like a list of different answers. Common problems when communicating with the medical team. And then also what's working well. And if you have any recommendations for us that you have implemented and has worked really well for you.